Heather, do you recommend an asthma action plan? And if you do, what's in it?
So an asthma action plan is a written plan for what to do when your asthma is at various levels of control. So it's typically divided into 3 zones: a green zone, a yellow zone, and a red zone. The green zone is sort of everyday. This is when your asthma is at its baseline, you're doing pretty well, and it reminds you in writing what you should be taking every day to keep your asthma well and controlled. The yellow zone is when you step up to that first level of noticing asthma symptoms. You might have some mild symptoms where you start to think about your asthma, you notice cough or wheeze or chest tightness, and it gives you a plan for how to use your rescue medications to try to get control of that asthma quickly and effectively. And it helps you to see when your asthma might be becoming less and less controlled, moving into the most severe zone, the red zone. This is the zone of the asthma action plan where really physician guidance is really needed. If you notice that your asthma symptoms are as they're described in the red zone, then you need to take your rescue medication, but also contact your asthma provider so they can help guide you on what to do next. The asthma action plan that we use right now is very often guided by symptoms, whether you notice wheezing, whether you notice cough, but sometimes the peak flow levels can be used for asthma action plans as well. How about you? What do you use for asthma action plans?
Yeah, I used to use peak flow levels, but the more recent guidelines are saying that people are not the most compliant with them, and they can vary quite a bit. So the asthma action plans, for me, many a time is symptom based rather than peak flow based. And the only other variation is if my patients really understand the disease and are really compliant with taking the medications, I may even give them a short course of oral prednisone to take at home once they're getting into the red zone, but not with every one of them, but the ones who really understand how their disease and are managing it well.